I had the procedure yesterday. It was fine. Like most of you have said on your post, the actual surgery site is the part that hurts the most, and I'm finding that too. The uncomfortableness of having the huge band-aid across your back is hard to sleep and hard to walk around, and the stimulator is putting, I'll show you the stimulator here. It's pretty big and bulky. For right now, you just see one wire coming out of that bottom piece, and that's because I only am dealing with one side of my leg, and the little man that you see on there in the corner is only working on one side. Is only working on one leg because I only fortunately have issues with one side of my leg. But things that you cannot do when you have this on are reach, twist, and bend, I believe, are the three things. And you cannot lift anything over 5 pounds. And he told me, excuse me, he told me that a gallon of milk is 8 pounds, so it just kind of puts it into perspective of what you can and cannot pick up. It's very difficult to all of a sudden just change what you're doing. Oh, I can't pick this up. I can't do that. I can't pour my kids apple juice. It's just, it's good to have people around you reminding you that don't do that. Anyway, the sensation going down my feet and down my legs is very odd. However, I have to tell you, I feel no pain in my foot right now, and I cried a lot when they were doing the test, because he turned it on and he said, "Do you feel pain?" And I said, "No." And it was the first time I didn't feel pain in my foot in a really long time. So of course I started crying. He stopped talking for a minute and just gave me a tissue, because it's been amazing. Now, when you do turn that machine off, the pain comes back instantaneously, and you have the pain that you had before. And when you don't have the pain, even for, say, 10 minutes, and then you turn that off, it's like the pain has intensified by 10. And I don't know why. I don't know how that happens or why it's happening, but it's almost as if my mind has forgotten what the pain felt like in just that short amount of time. And then when I turn the turn it off and then put excuse me, allow my foot to have that pain sensation again, boy, it's pretty strong. But the feeling, the only way I can describe it is when your leg is waking up, or say your foot or your hand or anything is waking up from being asleep and you have tingling needles. That is what's happening 24/7 as long as this machine is going. And if you could tolerate that, you'd be good to go. I would prefer that tingling over the pain any day. Now, granted, these are temporary, so they're just sitting in the spinal cord area. They're not implanted in there, and they're not calcified, which takes like 2 to 3 months. But right now, if I cough, if I make a sudden move, my machine will actually stay at a level that it's at. However, it moves within my spinal cord and will suddenly stimulate my legs, and you have to be really careful, because it can knock you out from under your feet and you just don't even realize what happened. My mom was driving me home from the doctor's, and she stepped on the gas, and it was like both my legs just started to go zzz, and like, wow, I didn't even realize what was happening. I do feel it in both legs, even though it has only been implanted in one, even though it has only been set up for one leg. I feel it in both of my legs. And to be honest, when you're in that much pain, I could care less. So that's for today. I'm back in bed because the surgery pain is painful, and I just want to rest and get over that, and look at the huge bandage later on today. Make sure that there's not additional bleeding, because there was some bleeding last night, and because we got 7 days of this, and this is day 1. So if you're thinking about it so far, I'm saying go for it, because it's It's amazing. Be back soon.